So, hey guys, I'm Dr. Lisa Wade, and I am starting a series of vlogs that I'm going to call Dr. Wade Talks Life, Dentistry, and whatever else. What I have noticed, and I know everybody's doing a post. I know everybody's doing Facebook Live. Everybody's recording their video. Everybody wants to put their 2 cents in. But what I've noticed is I'm getting the same questions in my practice over and over again. I'm getting the same questions in, life about my marriage and about my kids and about family. And these questions just keep popping up. And, although I'm seeing videos about so many different things, I haven't seen any relevant solutions or relevant answers to these questions that keep popping up. So I'm going to do this series of videos, like I said, and I'm going to call it Dr. Wade Talks Life, Dentistry, and whatever else. And hopefully, you guys will begin to respond, and you guys will give me good feedback, and you guys will bring me questions or subject matter or topics that I can research or just give you good feedback on. But one thing I don't want to happen, I don't want this to be boring. I don't want it to be technical. I don't want you to feel like you're in a classroom or anything like that. I want you to feel like you're informed. I want you to feel like, you are enlightened. And even if, sometimes I even want you to be a little bit entertained, if that's okay. So, but today we're going to start off with a question that I got this question a couple of years ago, and I even remember putting it out there on my Facebook page. But again, this question came up a couple of weeks ago, and I answered the question a couple of, the first time, but when it came up again, I thought maybe, wow, people are still wrestling with this subject matter. This is still a question to people, no matter how much literature that's out there. I guess people need it to be put in everyday life terms. So the question I got is, Dr. Wade, or Dr. Doc, they call me Doc in the office. Doc, can you get gingivitis from oral sex? And the answer to that question is, and I laughed, when they asked me the question. I laughed to myself. I didn't laugh to the patient because I didn't want the patient to feel uncomfortable asking me questions. And that's one of the things that, I'm really proud of in my practice, that my patients feel like they can talk to me about anything, especially the young people. And we'll talk about that, as we go on down the road, how you should feel comfortable talking to any of your healthcare professionals. But these guys, sometimes they feel too comfortable talking to me, and some of the questions can kind of really, I have to catch myself before I pass out, because those questions are coming, and there's some whoppers, I tell you the truth. But this young lady asked me, Dr. Nelson, can I get, or Dr. Wade, can I get gingivitis from oral sex? And the answer technically is, indirectly, yes, you can. And let's talk about exactly what gingivitis is. Gingivitis basically is a generalized term for inflammation or swelling of the gum tissue, or your gums. Basically, your gums are swollen, and a lot of times when you have that swelling, you have the redness, and you also have the bleeding. Now, I'm not going to get too technical. I know some of my colleagues will probably check out my video, but it's not for the technical aspect of the medical part of it, but it's for I want teenagers to be able to pick this up and be informed and listen to it, the average run-of-the-mill person, and not feel like they're reading a textbook. So let's go back to gingivitis. So gingivitis is the swelling or the inflammation of the gums. And so what happens is, when we talk about oral sex, let's talk about what exactly is happening there as far as the oral cavity is concerned. Anytime you have the exchange of body fluids, and that's what that will be, exchange of body fluids, there is whatever your partner is, whatever they have, basically during whether it's seminal fluid or saliva, or vaginal fluids, you're exchanging that from person to person. So you have to really, really be careful about the person that you're with, to be honest with you. And that's what I told the young lady. The take home from this is that you have to protect yourself. If you don't know that your partner's history, if you're not in a monogamous relationship, if the other person is not in a monogamous relationship, if the obvious most safe way to be is actually practice abstinence. But I'm real, and I know, how things are. And I know that, our young people, and even our old people for that matter of fact, or even our middle-aged people, or seasoned people, I don't want to say old, our seasoned people, they're engaging in unprotected sex. And so we have to, or they're not abstaining. So we have to make sure that they understand how important it is to protect themselves. And I know that's something that sounds like a broken record. We hear it over and over again. Strap it up, wrap it up, wear condoms, be careful, have safe sex. But until that disparity in our culture, in our African American community, until that gap of the number of African Americans who are affected by sexually transmitted diseases, whether it's syphilis, whether it's AIDS, whether it's gonorrhea, whether it's herpes, until we see that those margins come closer to the margins that we see in our Caucasian counterparts, then we need to keep talking about this thing, y'all. We can't assume that people are wearing their seatbelts when they drive. We can't assume that people are not texting and driving, so we can't assume that people are wearing condoms. Because and the evidence is there because of the amount of sexually transmitted diseases that we see statistically happening. So yes, you can get gingivitis along with many other things from oral sex. And one other thing I want to say is our young people, they don't consider oral sex. They don't consider, the only thing they consider sex is actual intercourse. But oral sex is still sex. You can get AIDS from oral sex too. You can get gonorrhea from oral sex. So you have to be careful. You have to know your partner. You have to protect yourself. You have to, unless you know for sure, the history of the person that you're engaging in the activity with, you got to be careful. I suggest you protect yourself. And it's not just young people. My seasoned brothers and sisters who are in the senior living communities, these people are older, but now they're healthier, they're exercising, they're living their lives, they're technology savvy, and they are engaging in sexual activity as well in their senior living communities. And grandma and grandpa in there getting busy, y'all. And there is an increased incidence of sexually transmitted diseases in our senior living communities as well. So we gotta make sure that people understand you have to protect yourself not only with actual genital intercourse, but you also have to protect yourself when you're engaging in oral sex as well, with condoms, with rubber dams, with whatever it takes to make sure that you are staying healthy. And we have to really drill that into our young people, and we have to really just have those discussions with them. I had a young lady who came into the practice a couple of months ago. Beautiful, beautiful girl, very soft spoken, just really, really sweet. And she has AIDS. She's 8 months pregnant, and she has AIDS. And what happened was she engaged in unprotected sex with her partner who did not disclose his sexual history and some of his sexual preferences. Basically, he was a down low brother. So, and it's not that it's a death sentence for her, but I wish she would have protected herself a little bit better, because now she has to manage this disease, and she has to manage this disease not only to make sure she's okay for herself, but to make sure she's okay for her new baby. So guys, I just really, 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 and not all these topics will be this heavy, but this one I think I wanted to start with because it's just been so recent in the practice, and it's something that I've heard more than once. So I just really want you to understand how important it is to protect yourself, and how important it is to understand that oral sex is just as risky as intercourse. So thank you so much for your time. Again, I'm Dr. Elisa Nelson Wade, or Dr. Wade, and you can hit me up on Facebook. I'm like young people now, hit me up on Facebook. You can hit me up on Facebook at Dr. Elisa Nelson Wade, or you can hit me up on Twitter. I think I'm on Twitter as Dr. A. Nelson Wade. That's Dr. A. Nelson Wade. And then on Instagram, I actually listed as my book. And my book is called Imitating the Tree, The Journey to Your Purpose and Destiny. Here it is. It's awesome too. And I'm just not saying it because I wrote it. Look at my picture on the back, girl. I look good. But this is my copy that I read all the time, because even though I wrote it, I go back to it, because I can't believe some of the things that I've written in here. They're so amazing. I think this was God working through me, definitely. But you can get this book on Amazon.com, and you can also get it on inspiredbyalisa.com, and I will send you an autographed copy on the inspiredbyalisa.com website. And once again, I thank you for your time, and we will talk again soon. Have a wonderful day.